One aspect of your professional life we have not touched on, and we've covered so much from, like you said, surgery, medicine, business, admin, industry, research. We haven't really talked about another, what I would consider a major aspect of what you do on a day-to-day basis, which is teaching.
Yeah.
We talked about how you're fellowship director to what I consider the best refractive and cataract surgery fellowship in the country, and maybe even in the world, when you look at sort of the experience that people have the potential opportunity to take with them for the rest of their lives. What motivated creating a private practice fellowship, and sort of what led to the infrastructure and the way it is today?
Yeah, it's interesting. It's almost by chance that we got involved in the fellowship. I think my partners and I sort of took it for granted what we were doing at the time of just this leading edge cataract surgery, refractive research, or whatever technology we're working with. We just assumed everybody was doing that. And then we would have a couple residents come through and observe what we're doing. They're like, oh my gosh, this is amazing. We're not being exposed to this type of technology or this type of style of practice. And one resident in particular, Amir Marafi, came by and he observed once and said, this is amazing. Give me a big hug at the end of the day. And the next time I saw him, he came back, started the day with a hug and watched what we did. And at the end of the day, gave me another big hug. He's like, Dr. Wiley, this is the greatest day I've ever had in my career, and really complimentary and so enthusiastic. He's like, you know what, if you were to do a fellowship, I would love to be your fellow and I'd love to learn from you. And at the time, I didn't necessarily realize or understand what kind of opportunity we might have to give to a young ophthalmologist to learn what we were doing. And so I guess in retrospect, it makes a lot of sense. Like I explained, we learned cataract refractive surgery over 20 years and had a slow trickle of innovation. But somebody coming out today has to be able to understand all the technologies that I've learned since residency. And there's probably 10 different new technologies that I've learned over the years. And so it's so much more challenging to stay competitive and stay active as a young ophthalmologist. And so to have the ability to sort of fast track a doc to expose them to the technologies that I learned over 2 decades for them to learn over a year is such a huge gift. And I look at what I said earlier, what allowed me to excel quickly is having some mentors that gave me that early confidence. And in retrospect, maybe it was earned or not earned, but regardless, they gave it to me, that early confidence, allowed me to sit down and do what I needed to do. And to have that ability to give back and give a young resident that confidence that after a year they can enter the ophthalmic world and be truly a world expert in cataract refractive surgery and carry that to their market, I think is really rewarding. And quite frankly, it's also made me a better surgeon. It made our team a better team. We have one other set of eyes that's constantly looking at all the charts, looking at all the surgeries, assuring we're getting the best possible outcomes. We're busy, and sometimes, if I'm busy seeing a patient, to have one other doctor with the expertise that we've imparted to them to be able to help with the team effort to see the patients or address the issues that may be there, I think is invaluable. So I realize that as much as it is an effort to teach, there's a reward to our patients, to myself personally. It's making me a better provider. It's making our team better. It's helping our field push forward. I think all those things are invaluable.